When I think about mental health and well-being, I oftentimes refer to the World Health Organization's definition, which is that mental health is a state of well-being in which an individual can realize their potential, they can cope with the normal stressors of life, they can be productive, and they can make a contribution to the society. We have been existing with so much oppression and dehumanizing experiences that we have to really work hard to maintain our mental health.
What do you think the relationship is between a birthing person's mental well-being while they're pregnant and immediately after giving birth, and whatever their mental health and well-being was before they've experienced pregnancy? Is there any relationship?
Absolutely, and thanks for stating it in this way. A woman's mental health does not just start with pregnancy. In fact, I dare say it started with her own being in the womb, because I mentioned earlier that depending on the mental health of a mother, vulnerability to mental health conditions can be transmitted in the womb. And then with the hormonal changes that happen during pregnancy, the vulnerability to mental health condition, I think, increases. So if we want to address maternal mental health, we have to start back to the maternal experience she had when she was being born. We have to create households where parents have enough support so that there's not childhood maltreatment. And so I think to take just a narrow individual look is not sufficient. It might be important, depending on the severity of, say, depression and anxiety that a woman is experiencing. We might have to consider treatment with antidepressant medication. For some women, they're vulnerable to developing bipolar disorders, so we have to do mood stabilizers. I know that's important, but the larger environment in which the woman lives, I think that's equally as important. And as you say, justice and fairness and access to resources. If you are a pregnant woman with limited resources, of course you're going to worry. That in itself, poverty is a stressor. And there's no antidepressant that's going to make that go away. So I think we have to really use more of a social ecological model in the way we think about Black maternal mental health. It's very different with white women. Now, interestingly, the data shows that mental health conditions are more prevalent in white women, in particular if they're living in poverty. Again, I go back to saying that we've had to be so resilient. There are times resilience helps us, and there are times it works against us. We have a high tolerance for stress. But unfortunately, when we break, we break.
Thank you so much for being with us, Dr. Shervington. I'm Dr. Lisa Richardson. I'm with the Institute of Women and Ethnic Studies, and we're here to celebrate and reflect on Black Maternal Mental Health Week. We know that these issues and the struggle for justice and joy for all Black women and birthing people goes on far beyond this week. We hope that you all will enjoy the rest of what we have to talk about and share with you over this time. Stay tuned in to hear more about the programming we do in the maternal and child health space, the way we work with medical providers and doulas and community providers, and get involved with our programming and support Black mamas everywhere. Thank you.